Alright, let's talk about electrolyte replacement in inpatient setting. So let's talk about potassium replacement first. So the first thing you need to know what's the normal potassium range, which is from technically 4 to 5. And also you need to remember how much potassium you need to give to increase 0.1 millimole per liter. So every 10 milliequivalent IV or oral raises serum potassium by 0.1. So let's suppose if someone's potassium is 3.5 and you want to be at the level of 4, you have to give at least 50 milliequivalent IV or oral, because every 10 increases 0.1. So total 50 would increase 0.5. And that's like a general rule for normal patients in terms of the kidney function. If the kidney function is okay, every 10 milliequivalent of potassium increases 0.1 millimole per liter. And also if patients have hypomagnesemia, low magnesium, you have to treat the magnesium first. Otherwise potassium most likely won't be corrected with the potassiums you are giving. So let's talk about the magnesium first. So the normal magnesium level is like more than 2, and mostly we treat magnesium if it is less than 2, because hypomagnesemia can cause arrhythmia, especially AFib, torsade. So how much you give? So let's talk about how much magnesium will increase if you give a 1 gram IV magnesium sulfate. So if you give a 1 gram of IV magnesium sulfate, it would raise magnesium by 0.1 to 0.2. So for every 1 gram, which is 1000 milligram, magnesium would rise by 0.1 to 0.2. So let's suppose if someone's magnesium is 1.8 and you are giving 1 gram of magnesium sulfate, so it will increase 0.1 to 0.2. So it will raise from 1.8 to 1.9, or maybe 1.8 to 2, because every 1 gram of magnesium sulfate increase magnesium by 0.1 and or 0.2. So how much magnesium you give, it depends on the level of magnesium. So we divide hypomagnesemia into 3 categories: mild, moderate, or severe. So normal is about 2, mild is from 1.5 to 1.7, moderate is in between 1.2 to 1.5, and severe is less than 1.2 or symptomatic. So if it is just like a mild hypomagnesemia, like in between 1.5 to 1.7, so you give 2 gram IV every 2 gram of IV magnesium over 2 hours. So that would increase 1.7 to 1.9. And if it is moderate, 1.2 to 1.5, then we give 4 gram of IV magnesium over 4 hours. And if it is symptomatic or severe, then we give 6 to 8 gram IV divided over like 8 to 10 or maybe 8 to 12 hours total. And that's like a general rule of thumb for potassium and magnesium. So in patients, mostly we see patients with hypokalaemia and hypomagnesemia. So particularly be careful if patient have any arrhythmia, like if patient present with AFib, atrial flutter, VTAC, something like that. So those patients need to be very careful.